them. So the next presentation is from Dr. Osahon Enabulele. The floor is yours, Doctor.
Yeah, good morning, good afternoon, good evening, everyone. I bring you greetings from Edo State in Nigeria, in Africa. And I'm very excited to be on this call. I have the task of providing insights into how we contend with medicine pricing, particularly in a low middle income country like Nigeria and of course other African countries. And I am a family physician. Next slide. I have no conflict of interest. A family physician practicing in a family practice clinic in the University of Benin Teaching Hospital. The University of Benin Teaching Hospital where I practice is a tertiary hospital located in the south-south zone of Nigeria, within African region. It renders both inpatient and outpatient care and has a family medicine department, which runs an outpatient care service through its family practice clinic. There are several hundreds of patients that are seen on a daily basis. And so we have very real-time experiences in terms of our patient encounter to, of course, give a narrative on their experiences, especially with respect to the prices of medicines. Next slide, please. And so we must understand that medicine pricing has had tremendous impact on care outcomes in terms of treatment outcomes. It has had impact on patient experiences, especially the critical issue of access to care. So the rising cost of medicines has undoubtedly impacted on access to care, and of course challenged the whole concept of universal health coverage. Next slide, please. And so it's an issue that we need to engage. And of course, we constantly engage as physicians, also as family physicians in our practice clinics. Of course, we all know why there's escalating cost of medicines. There are several reasons for this, especially for those of us who practice in low middle income countries. It revolves around economic challenges. Of course, we all know that not only has the COVID challenged lots of economies, but again, even local experiences, in-country experiences, sometimes in terms of governance issues, has led to poor economies and, of course, rising inflation, which has impacted on the prices of virtually all commodities consumed by citizens, including medicines. So, and it is even worsened by the fact that more often than not, you have the absence of local drug manufacturing systems on ground, and so most of the drugs are imported and determine that the prices of those who are producing them. Of course, the whole problem of import duties on these imported drugs has not also helped matters. Of course, even with the reliance on generics, there has been a challenge of the quality of generics put on offer. And that, of course, has led to the propensity to resort to branded drugs with the high cost of those patented drugs, branded drugs. Of course, there's been the issue of ineffective implementation of guidelines, including the essential drug list or the essential medicine list, and poor social health insurance schemes, which has also led to people being unable to afford this high cost of medicines without social protection or, of course, social security systems. Next slide, please. There are other issues that have led to this. We have the issue of ineffective price control mechanisms. These prices are not well controlled, and so the marketers and the producers sometimes overwhelm the system with their own prices without any kind of effective regulation and control. We have the case of defective procurement systems, which sometimes is on drugs are procured sometimes on the basis of the highest, those who can lobby more, engage the system more, and get their own interest, sustained. We also have the profiteering propensities of most of these drug manufacturers. Medicine is all about quality care and quality outcomes, without, of course, allowing the whole quest for profits to interfere in your care process. But we know that these manufacturers of these drugs want return on their investments. And sometimes this has led to very high profiteering propensities, which also have affected drug pricing. Of course, the whole issue of stockout, next slide please, is also an issue, which of course has led to the issue of the challenge of the supply-demand equation, which of course impact on the price mechanisms. Because of time, I would like to look at some ways in which we have tried to, of course, advocate for the better handling of drug pricing. We have the issue of trying to advocate as physicians for improved funding for health. We know that most African economies have very poor health expenditure. Not more than 1% of the global health expenditure is, of course, accounted for by African economies or African governments, and that obviously is very poor. So, in the face of poor funding, of course, not able to cushion the economic challenges, and of course, the pricing issues, we find out that the patients are left to contend with the whole challenge of rising prices. Of course, we've always called for greater commitment to universal health coverage as physicians, because we advocate for our patients, because the whole essence of universal health coverage is to ensure that there's some level of financial risk protection for our patients. And that also includes the prices of medicine. So when you have a very strong health system, strong primary care system, and of course, with very impressive levels of universal health coverage, the patients are able to, of course, get better access to care, including access to medicines. We've also called for quality control of generics, because part of the challenge why there's increased prices, especially for branded drugs, is the fact that even the generics that are put on offer sometimes do not have good quality. I've had personal experiences with this, so it's something that I also think needs to be addressed. Because if people have confidence in the use of generics, a lot of the prices will go down, especially for the patented branded drugs. As physicians, what we also do is to advance the whole concept of patient-centered care, which of course integrates the concerns of the patient in the whole care plan, trying to achieve a patient-physician agenda, so that also we can, prescribe, in accordance with the expectations and the needs of the patient, and of course ensure that they comply or adhere with our treatment prescriptions. Next slide, please. So it's very critical as in this whole aspect of medicine pricing. I mean, the escalating cost of medicines. Next slide, please. To build into our practices the concept of patient-centered care. Like I said, it's an approach to patient care that seeks to address the needs and expectations of the patient in the care process. So the patients need to be brought into the agenda. They need to know that, look, these are the issues bordering on affordability. These are the options in terms of treatment options. And they're able to, of course, appreciate why, whatever is the eventual plan has to be, of course, complied with. And of course, with the support by us physicians to ensure that there is greater adherence to prescriptions. Next slide, please. So patient-centered care is critical in managing the whole cost concept, increasing prices of drugs. Next slide. Next slide, please. All right, so there are other issues that as physicians we advocate for, even within the confines of our practice environment. We always like to advocate for improved indigenous drug manufacturing, which can also help to, of course, reduce the cost of medicines. If you continue to rely on external producers, the tendency is for the prices to remain high. So once you have local drug manufacturing mechanisms put on ground, the tendency is that most of these prices in low middle income countries, including the countries of Africa and even where I practice, will of course come down, because the whole supply demand equation, we have an effect on this. Of course, we always like to call for fair pricing, to insist that you have price intelligence units set up, drug price monitoring and control, and of course, to ensure that the procurement mechanisms integrate the perspectives of the end users, including physicians who manage these patients. Because most times the perspectives of the physicians are not integrated in the procurement systems, procurement mechanisms. So the end users need to be built into the whole concept so that they can tell their own experiences and ensure that there's some level of control in terms of the prices of medicines to be prescribed within the practice environment. Of course, as physicians, we also join others to call for improvement in good governance, in the concept of to call for improvement in the economy through good governance, and also the address of other social determinants of health. And we also believe that the address of stockouts and patents are also issues that we need to contend with. Next slide, please. So as physicians within our practice environment, we not only engage the patients to, of course, ensure that they appreciate prescriptions and treatment plans, but also advocate for them as even beyond our clinic environments to ensure that the issue of fair pricing is an issue that is taken on board. We think that, in conclusion, that medicine pricing is critical to patient care and overall health outcomes. The current escalating cost of medicines is a significant barrier to healthcare access, but for better patient experience and attainment of universal coverage, we're convinced that it is important to ensure a fair pricing mechanism. But again, this needs the collaboration of all stakeholders, including physicians and other care providers. Thank you. I'd like to appreciate the World Medical Association that gave me this opportunity to make this presentation, and of course the World Health Organization. And I also want to appreciate my family for of course tolerating my absence from home at this point in time. Thank you.
Thank you. Very important acknowledgement, and thank you so much, Dr. Osahon, for sharing your perspective, particularly not only as a clinical clinical service providers, but also as an advocate for your patients as well. So I'll come back to the role in terms of patient-centered care and whether or not there's any tensions with the population decisions, like in terms of what to fund, what to buy, and how the health system is designed. So we'll come back to that point later on. So next, we will hear a presentation from Dr. Manju Singha. So next slide, please.